Welcome to the League of Women Voters and the Alliance for the Arts Virtual Candidates Forum. Some of the League's voter service activities include candidate forums and voter guides. This information is made available to the voting public to help in their decision-making process. The League of Women Voters is a nonpartisan organization that does not support or oppose candidates or political parties. Happy learning.
Welcome to a candidate forum presented by the League of Women Voters of Lee County in conjunction with the Alliance for the Arts. The purpose of these forums is to inform the voting public of the opinions of the candidates running for office. It's not a debate. There will be no crosstalk between the candidates. There won't be any comments from one candidate on another candidate's position. They will be given 2 minutes to open. They will be given 2 minutes to close. They will be given 1 minute to answer each question. The order of answering the questions and opening and closing is random, to be decided at the beginning of the forum itself. So sit back and enjoy. Thank you.
Meredith Gentleman, member of the League of Women Voters of Lee County, and welcome to this candidate forum featuring candidates running for the Lee Memorial Health System Board of Directors, District 1 and District 5. All candidates running were invited to participate in this forum. Let's start with our 2-minute openings. I'm going to ask Mr. Brown if you'd begin, please.
Sure. Hi, my name is Steve Brown. I've been on the hospital board for 12 years. In the way of the background, I married my college sweetheart. We've been married for 56 years, had 3 children. Unfortunately, we lost our daughter to breast cancer at a very young age. I was on the city council in Sanibel for several years and former mayor. One of the main reasons I want to run for the hospital board is medicine has been so good to me. I'm an MD and a board certified radiologist. And I wanted to have the opportunity to give back. The hospital board is a wonderful opportunity to do that. And my family and I have been very actively involved with the hospital system. As a matter of fact, after our daughter passed away, we founded the Chrissy Brown Inpatient Cancer Center at Golisano Children's Hospital, and we've stayed involved with it ever since. There's several challenges that we have ahead of us at the Lee Health. Unfortunately, some are immediate and some are longer term. The immediate ones obviously deal with coronaviruses and its impact on medicine. The fact that we haven't had elective surgery for a period of time has really cut into our finances. The other challenge is our CEO, supervising our CEO, and which we have an excellent CEO, and also doing quality and patient care. The third thing that we're going to look at is what does the future hold and how do we handle the future? There are many challenges ahead of us in handling the future, and medicine is changing so rapidly. But I think with our team effort and all of us working together, we'll do very well in the future. Thank you very much.
Thank you. Therese Everly.
First of all, let me thank the League of Women Voters for this forum and this opportunity to address your group today. I appreciate you all being engaged and including the Lee Memorial Health System Board of Directors. Just a little bit about myself. I currently serve as the Vice Chair of the Lee Health Board of Directors. I also serve as the board chair for the Quality Safety Patient Experience Committee, and I am a member of the Community Health Improvement Committee, which is tasked to ensure we are meeting our community impact, our mission and vision in the community. Very, very excited about being on both of those committees. I have over 30 years of healthcare management experience by clinical background. I'm a registered respiratory therapist, but I have a bachelor's in health administration. I currently work as a realtor. I've been doing real estate and property management for over 30 years. So prior to being on the board, I was focused more on my healthcare career. Now being on the Lee Health Board, I'm focused on real estate, as I cannot be employed by the health system. I consider it an honor and a privilege to be on the board to advocate for improved access to quality care that is affordable and at the same time ensures the long-term financial viability of our, in my opinion, community's greatest asset, our 100-year public health system. We are actually the largest public health system in the United States with no taxing authority, and I'm proud we're able to continue to do that. I'm very engaged in the community. I sit as a board member on the Lee County Homeless Coalition. I'm on the Florida Gulf Coast chapter of the Alzheimer's Association, which covers 16 counties. I'm a founding member of the Department of Elder Affairs Dementia Care and Curative Initiative, where we're focused on making Lee County dementia caring. And one of the greatest things I've been able to work on is I'm a founding member of a Lee County-wide ad hoc committee with community stakeholders that are focused on developing.
Thank you, Ms. Everly. Thank you. Appreciate it. The first two candidates are running in District 1. Our next two candidates are running in District 5. Kathy Bridge-Lyles, your opening statement?
Thank you. Yes. Good morning. My name is Kathy Bridge-Lyles, and I am an RN by trade, and I have a master's degree in administration. And I, too, want to thank the League of Women Voters for hosting us today. I've been a member of the League for about a year now, and it's been very enlightening to learn all of the political concepts and ideas that the League of Women Voters puts out. So I have worked and lived in this community for 30 years, and the entire 30 years I have been at Lee Health. And so I started as a bedside nurse, as a registered nurse, and in the pediatric intensive care unit. And ultimately, I became the chief administrative officer of Golisano Children's Hospital. And during that time, during my tenure as chief administrative officer, I managed a $50 million budget annually and always came in under budget and always exceeded the goals and expectations that the system set for me. We raised with the foundation and Sharon McDonald $102 million so that we could build the new Golisano Children's Hospital, something folks thought that would never happen, but we successfully built it, opened it 3 years ago, as you know, and I had the responsibility and oversight of the design of the construction team, and it was an honor, and I learned so much doing that. I can bring to the board my expertise, my knowledge, and my experience, and I can make a difference in the boardroom when I bring these.
Thank you. And Ms. Peer, your opening statement.
Yes, I want to echo the thanks for this opportunity to introduce ourselves as candidates for the Lee Health Board of Directors, which is an at-large race as Lee Health serves all of Lee County. My name is Jessica Carter-Peer, and I'm currently running for re-election for District 5 seat. My story is unique in that I'm all combined a product, consumer, and producer of the Florida healthcare system. As a Florida native, I was born in Ocala at Monroe Regional. At 18 months old, my life was saved at UF Shands in Gainesville. I earned a position working for Lee Health Wellness Centers after I graduated from FGCU as an exercise specialist. And I'm married now for 6 years, and we had our daughter at Health Park Medical Center. So I'm now about to complete my doctorate at FGCU for physical therapy. And I've had an amazing opportunity to be a part of this conversation when it comes to healthcare here in Southwest Florida. I was first elected as a single female, and my roles in advocacy have transformed into being a voice for the young adults and professionals here in our community. I am running for re-election to continue to be one of the 10 members on the board, as those young professional demographics represent roughly 22% of the population here in Lee County. Serving on this board has opened my eyes to the constant challenges that we are faced with in healthcare today, whether it's affordability, access to timely medical care, dwindling reimbursements, and now the processes of a pandemic. I have gained the expertise and experience of asking tough questions, learn the value of being a trustee to this community asset, and I don't take this role for granted. I currently serve on the audit committee, and I'm the current chair of the governance committee, and I would be my honor and privilege to continue serving here in Southwest Florida this November by being reelected to Lee Health Board of Directors, District 5.
Thank you. So now we'll start with our questions. And for the first question, I'm going to direct it to Therese Everly. What are the most important challenges facing this system, in your view, and how do you propose to address them? In 1 minute.
Wow, 1 minute. Currently, the most important challenge is the COVID crisis. We put together an aggressive financial plan to be able to keep our 100-year system solvent. So I'd say in the forefront right now, it is the COVID crisis. Also, with the Affordable Care Act, we have to shift from for service to value-based care reimbursement. So it's becoming an expert in that space with the repeal of the certificate of need, and the certificate of need not having any guide rails around it as regards to competition. As a public safety net institution, we take all patients regardless of payer. So we will be in a much more competitive environment. I'm up for competition. Competition does drive increased quality and also increased access. I'm confident we will get there. And we are looking at all new risk models, leveraging technology. So I'm confident we got the team to get there.
Thank you. And Ms. Bridge-Lyles, what do you think the most important challenges are facing the system, and how would you address them?
I agree with Therese in the fact that our initial challenge is our financial stability. I think that, this pandemic has had a very challenging effect on every business, on everyone in the country. And Lee Health was not able to avoid the issues, the financial issues that have come forth. We have learned a lot. We have learned issues related to our supplies and our staffing and how to better manage them. I worked with Jim Nathan in 2008, and we faced a similar crisis financially for the system, and we were able to turn that around in about 3 years. So I look forward to exercising some of the same results with the new board if I'm elected to the board.
Thank you. And same question, Ms. Peer.
Yes, so they touched on a lot of great topics as we are faced with a lot during this pandemic. My main focus would be maybe along the lines of technology and the delivery and the access to care. Certainly we're in a certain new delivery model. We talk about delivery of care and access of care. So my focus will be on the quality of that delivery. We talk about telehealth and how that impacts our patient populations. And certainly it's going to be one thing to start to come online and do new things and new processes for healthcare, but it's another thing to talk about cybersecurity risks and that when it comes to patient data. So my focus will be on the protections of our patients' vital information and the information that is shared across these devices.
Thank you. And Mr. Brown.
The thing about going last is you can say ditto. I agree with everything that's been said up to this point. As I said earlier, I see the problems as both an acute and a chronic problem. And we've already touched upon the fact of the coronavirus and the impact it's having on the community. And obviously the financial impact it's having on. Apart from that, I think one of the main things we have to be concerned about is competition. With the CON gone and lots of people eyeing Southwest Florida as a potential place to set up healthcare systems, we're going to have a lot of competition from the outside. So it's going to be survival in the future, financially especially, but also with the quality of care and the delivery of care to the people in our community. Thank you.
Thank you. Thank you. So moving on to a new question, we'll start with Ms. Bridge-Lyles. How have you used your education and experience to pursue matters of importance in the public sector and in the community?
So, as I mentioned earlier, I'm a registered nurse, so I have the clinical expertise to bring to the health system and to the community. And I also have an MBA, so I have the business knowledge and experience to bring to the community and to the boardroom also. One of the ways that I have used my education and my experience is by working on numerous community boards and building programs for the pediatric patients. I am thrilled that when I am on the board, I will be able to serve both the adult and the pediatric population. But I used my skills to build relationships and through sitting on many boards and then collaborating to build special programs. Thank you.
Ms. Peer.
Yeah, so my experience has been along the lines of education and really bringing awareness to the advocacy efforts here in Southwest Florida. Running at such a young race, when I first got elected, it was one thing to educate the community about what Lee Health is as an asset to our community and being a part of the community in a bigger way. So my focus will be on community building relationships. I serve currently on the FGC Alumni Association Board. So we're really working on that avenue of building relationships with everyone in the community that we touch. So the healthcare is a big vital part to us and our success. So especially with this coronavirus pandemic, it's important that we build those relationships throughout the community.
Thank you. And Mr. Brown.
Yes, well, this is a very important topic, obviously. And I think that the important thing, as far as my background, obviously I'm an MD and I'm also a board certified radiologist. When I took an early retirement, we moved to Sanibel and my wife told me to go find something to do. I was like having a grand piano in the kitchen. So I got involved with politics and became the mayor of Sanibel. And then I decided after 8 years of doing that, I wanted to use my clinical experience and ran for the hospital board, which I said I've been on for 12 years now. And I think the important thing that I can bring there is a team player. I believe in listening to other people and listening to other ideas and to contributing together as a team. Team play is going to be very, very important in the future. And it's like the three-legged stool we talk about: administration, medical staff, and the board. Thank you.
Thank you. And Ms. Everly.
Well, thank you for that fantastic question. So one of the things that I've been very passionate about, I've been involved in nonprofit work since I was 12 years old, volunteering at Reverend Suarez's first soup kitchen down in downtown Fort Myers. Currently, one of the great tasks that I have at hand is I'm on a 5-year ad hoc strategic planning committee focused on setting a county-wide strategy on behavioral, mental health, substance abuse disorders with the justice system, with healthcare, with all community stakeholders. I'm taking the experience that I've garnered over the years on my service at Lee Health, going to national conferences, learning about the social determinants of health. I'm engaged with United Way, Mission United, advocating for veterans services. Actually have firsthand experience advocating for a new way we screen veterans that need services in our community. Passion for dementia and Alzheimer's. It has impacted my family tremendously. So taking those skills and seeing what happens in the hospital, because I used to be a care manager, a clinical care manager at the hospital for over 6 years. And I'm using those skills to be on the Alzheimer's Association board and the Dementia Care and Curative Initiative. Also have a passion on human trafficking, which I've been involved in and on a board in the past.
Thank you. Thank you. Okay, so we'll move to another question, and I'll start with Ms. Peer. Obviously, coronavirus has highlighted the difference in access to care among different communities in Lee County and across the country. How would you improve access, availability, and affordability of healthcare and mental health services in Lee County?
Well, certainly that is a great question. It kind of piggybacks on the thought of what does telehealth do to our access to care? And certainly when we talk about quality of care, we think of face-to-face, in person, and we're starting to see how much of that delivery can be accessible through telehealth. And as a focus, we certainly are the safety net healthcare system to this region. So to serve our region, to deliver the care in a timely and efficient manner, that's something that we're looking at. We've established a lot of the mobile testing sites that were available early on in the pandemic. So we're going to garner a little bit of what we learned from even just doing those processes to see how we can change the healthcare environment in this community.
Thank you. And Dr. Brown?
Well, this is a terrible problem, this pandemic with coronavirus. And this country hasn't seen anything like that since 1918, which was a pandemic as well with the influenza, with hundreds of thousands of people dying around the world. I think the most important thing that we've done as a health system is being advocacies and educating people. It's very important to know about wearing masks, social distancing, washing your hands, testing for people that need to be tested, the availability of healthcare to those people that are going to need health care, and also the isolation of people, unfortunately, like me, who are older with pre-existing conditions, to use some isolation. The answer isn't going to be a vaccine. That's certainly going to help, but it's going to be finding treatments for it and to change the way that we live. And that mainly encompasses all the above things that I said.
Thank you. And Ms. Everly?
So the COVID crisis has really shined a light on the access issue here in Lee County. It's something that those of us in healthcare policy have been aware of, but if there's a silver lining, this is one of them. And it became apparent that the Dunbar community, the Suncoast community, and the homeless community had access barriers to healthcare and testing. We have what's called the Lee Community Health Clinics. It's set up as a federally qualified health clinic lookalike. A huge advocate for the expansion of those clinics, providing telepsychiatry. Right now we have telepsychology, and continuing the partnership with universities, doing possible internships to leverage that asset. Also looking at delivering care to these communities where the people live, via whether it's a mobile bus, it's a pop-up unit, something along the lines of that. So that's how we're going to meet our mission and vision as a safety net.
Okay, and Ms. Bridge-Wiles?
When we talk about access and availability to care, the first thing that comes to mind for me also are the federally qualified health centers lookalikes that Lee Health took over when they were dissolving. And we have provided so much care in our community, tens of thousands of people are receiving care that don't have the ability to pay. And so we will continue to implement programs like that. Actually, just a quick focus on mental health. There is a qualified health center lookalike for mental health in World Plaza for adults. But in this past year, the Golisano Children's Hospital have increased visits, psych and behavioral health visits, from 1,500 in 2017 to 11,000 in 2018. So we will continue to work toward increasing that availability.
Okay, thank you. So we will move to a new question, and that is, there is, of course, a possibility of a second wave of coronavirus coming in the fall and winter. What steps do you think the system should be taking to prepare for a possible second wave? And I will start with Dr. Brown.
Thank you very much. That's a fantastic question, and it's a concern of everybody. We have been very fortunate with our system to have Stephanie Sobel and Mary Beth Saunders quarterbacking our infectious disease. And I think there's no doubt there's going to be a second wave. So the thing we have to do is all the things that I suggested beforehand. And isolation is one of the biggest things, and wearing the mask. But the other thing people have to do is get a flu shot. Only 50% of the people get a flu shot. And the worst scenario that we could have as a healthcare system is to have people coming in with a flu and then with coronavirus as well, trying to differentiate which one it is. And the second thing is, if someone gets the flu and also gets the coronavirus, it's going to be terrible. So there will be a second wave, but we have to do everything we've been doing and continue to do it. Thank you.
Thank you. And Ms. Everly.
So the second wave, this is something that we are concerned about because there has been some suggestion that the flu had impacted dramatically Wuhan when they originally had their outbreak. Lee Health has been very engaged with community stakeholders. I've been involved behind the scenes in many of these initiatives, both with the Lee County School District, the Board of County Commissioners, and various municipality city managers about how we come together and we public message. I'm very involved with the Cape Coral City and the Board of County Commissions in these countywide public health messaging. You must get your flu shot. You must social distance or wear masks. These are the types of things that are going to help us stave off a second wave. Dr. Mike Martin is very close with Lee Health. Lee Health has worked very closely with FGCU on their mitigation plans. FGCU is doing some incredible innovative work on determining COVID outbreaks before they become that in the dorms. They're using best practices. Yep. I'm hopeful we will be able to stave off a second wave, but we have staffed up. We do have our PPE stock, and we are financially prepared.
All right, thank you very much. And Ms. Bridge-Lyles.
Yes, when we look at how we will handle this next epidemic or pandemic, I think the most important thing is to know that we learned a lot from the initial pandemic, and there are new policies in place that we need to have reserves of PPE, personal protective equipment, and ventilators, which we were not prepared for when COVID-19 first came to our country. And so I think we've learned a lot through that. The other thing with regard to staffing is that we know a lot about staffing because we are a seasonal healthcare system in the sense that we're really busy in the winter because of snowbirds wanting to be here, and we're not so busy in the summer. So we learn how to flex up, how to flex down, how to use special programs so that we have supply and demand and appropriate safe staffing when needed. Thank you.
Thank you. And Ms. Peer.
I'm going to take Dr. Brown's statement and say ditto. There's a lot of great statements that were made in terms of how do we look forward to what the second wave may be. One of the things that I'm hopeful about is a possible therapeutics and things that are coming down through the science and through the knowledge that we've gained over time now. So when we talk about prevention and wellness and trying to stave off a second wave, one of the things that we can start to do is, again, advocate for, social distancing, hand hygiene, staying away from large groups and mass gatherings. But certainly that's something that we have learned a lot from. And I hope that we will not see the second wave as much as we have learned from this first wave. So that is my hope, and we'll continue to work with our community partners in staving off that and keeping to the forefront and keeping a pulse on what's happening in our community.
Thank you. Now we'll turn to another question, and I will ask Ms. Everly to kick this one off. I want to talk to you about coordinating with Lee County government. What issues do you think either need to be coordinated with government, Lee County government, or if already being coordinated, need more work, need more coordination? Are there issues of coordination that come to mind?
Okay, so you're hitting on a passion of mine. I'm very engaged with the Health and Human Service and Veterans Affairs at the county level, working on identifying and strategizing how we improve the quality of life for people in Lee County while addressing the social determinants of health. So what does that mean? I have been advocating myself and other community stakeholders for example, a HOTS team, a homeless outreach team, to be staffed by law enforcement and mental health counselors to try to address the homeless crisis. It's on the forefront of my mind when I read what the COVID pandemic has done across the country and the increasing in homelessness in young people. But I do want you to know the fastest demographic is women 65 and over that are becoming homeless in the United States.
Thank you, Ms. Thank you very much. Ms. Bridge Lyles.
Yes, one of the things that I think we can do a better job at, especially now with through the pandemic, is to address the healthcare needs of the individuals that have lost their jobs, have lost their insurance, and really the last thing that they're worried about at this point is access to healthcare. They're worrying about putting food on the table. They're worrying about feeding and clothing their children. And so one of the things I think we need to do is to assure, work with the governmental entities to assure that healthcare is provided to everyone. And certainly depending on the election, we will have to see how that pans out and how it impacts our healthcare. But that's one of the roles that Lee Health needs to be very, very involved in.
Thank you very much. Ms. Spear.
Yes. So what this pandemic highlighted to our community was the partnerships that we have in emergency response. So due to major hurricanes, and usually that happens here in Florida, we have emergency response teams that can highlight any of the critical needs in our community. I hope that with this partnership that we move forward in a positive light of going forward with this a new partnership with the community. So Commissioner Brian Hammond and everyone that is a part of our critical needs and access to care. So we could take those new delivery models and help bring the access to that individual. So hopefully the new the new solutions that have come out of this will create a positive impact to the access of care.
Thank you. And Dr. Brown?
Yes, it's sort of interesting that this topic comes up now. We had our Kiwanis Club meeting this morning on Zoom, and Kevin Ruane, who's a Kiwanian, was our guest speaker. And this exact question came up, was the healthcare system working with Lee County government. And I'm very positive about it. I think that Hammond and those other people have really been cooperative in addressing the issues. I know that they've met with Larry Antonucci and other people on the healthcare senior level. And it's a good solution right now. They're working on it. And I don't have any real criticism of the way that the government is working with Lee Health. I think we're all on board. I think, look at the number of cities that have brought in wearing masks and trying to do the isolation and distal separation. So I think that they're doing a good job, and I think it will continue.
Thank you. So this brings us to our closing statements. So I'd like to start, please, with Jessica Carter-Peer and her closing statement.
Again, thank you for this opportunity to highlight our board of directors here at Lee Health and the role that we serve here in our community. As mentioned, all of our districts are at large, so you do not have to live in my district to vote for me. As you can see, I'm a motivated millennial, and I will continue to work for you as a community member who has a passion and energy of making a difference. As an advocate for wellness and prevention, I will continue to be a visionary for the future of healthcare. And if you want to know more about me, or have any questions, you can reach out to me on any other social media, on Facebook, Twitter, Instagram, or LinkedIn. You can visit my website, www.jessica4leehealth.com. And remember to tell everyone to say yes, vote Jessica Carter-Peer, Lee Health District 5 on November 3rd. It would be an honor to continue to serve this community.
Thank you. Kathy Bridge-Lyle.
Yes. Opportunity to be on the Lee Health Board of Directors. I've presented to the board for the past 10 years many different projects and concepts that I wanted to bring to life. And I have always respected and admired the knowledge and the expertise that the Board of Directors carries. And so to be a part of that would absolutely be an honor. My 30 years of clinical experience and operational experience and the successful results that I have achieved during those 30 years certainly makes me a valuable member for the Board of Directors. I was told once by a good friend that there would never be a children's hospital in Southwest Florida because we needed to focus on the adults in the community. And I saw the need and I saw the opportunity through philanthropy to make that happen and to get board approval for that, which was certainly a daunting task. And I think there's things that I learned during that process will really help me be a very, very valuable board member. So I want to thank you for this opportunity to talk about the Lee Health Board of Directors, and I look forward to serving you in the future. Thank you.
Thank you. And Therese Everly, please.
Yes, I want to just say I absolutely consider it an honor and a privilege to serve as your representative currently on the Lee Health Board. I will continue to work hard to advance accessible, high-quality care while still ensuring our financial viability as a safety net in your public health system. I'll always advocate for strong policies and strategies that meet our Lee County unique needs, and always focusing on the whole person, the mind, the body, and spirit. I would be incredibly honored to ask for your vote. Thank you for this opportunity today.
Thank you. All right. And Steve Brown.
Okay, thank you very much. And I want to thank the League of Women Voters for this opportunity. I find it fascinating that you're doing this because the first time I ran, we were with everybody that was running for anything in Lee County. And it came around to the hospital board and it was 11:30 at night. And the only people were there were the candidates and some of their spouses. So we were talking to the chorus, you know, but this is a fantastic opportunity. And I just like to say also to the other candidates that were on here today, I'm so happy that you are running because I think you're the cream of the crop, and I have all the confidence in the world that we could form a great board together. Looking down the road and what we have to do, the challenges are going to be very demanding in the future. So it's going to take all of us working together. But the main thing is we're going to have to work with the administration, the medical staff, and the board. I find it interesting. Several years ago, I was working at a hospital, and somewhat the administrator was not real excited about doctors. And I finally said to him one day, imagine this. Sounds like that song Imagine, doesn't it? But I said, imagine this, a hospital without doctors. And you know, one of our local hospitals in the last 2 years actually did that. Administration challenged the doctors, and that administrator is no longer the administrator. So it's very important for us all to recognize each other, to work together, and we will make this a great, continue to make this a great medical community. Thank you very much.
Thank you. So on behalf of the League of Women Voters of Lee County and the Alliance for the Arts, I want to really thank you candidates for your time and sharing your ideas on what you would do if you were to be elected. Just a reminder to voters that vote by mail ballots can be requested to be mailed to you until October 24th, which is Saturday. Early voting begins in Lee County on October 19th, and Election Day is November 3rd. So good luck to all of you candidates, and thanks for participating.
Thank you so much.